Conditions related to sexual health. This includes sexual dysfunctions and sexual pain disorders. Sexual dysfunctions, conditions related to sexual health. Sexual dysfunctions are syndromes that comprise the various ways in which adult people may have difficulty experiencing personally satisfying, non-coercive sexual activities. Sexual response is a complex interaction of psychological, interpersonal, social, cultural and physiological processes, and one or more of these factors may affect any stage of the sexual response. In order to be considered a sexual dysfunction, the dysfunction must, 1. Occur frequently, although it may be absent on some occasions, 2. Have been present for at least several months, and 3. Be associated with clinically significant distress. Type of sexual dysfunction based on International Classification of Diseases 11th revision ICD-11. 1. Hypoactive sexual desire dysfunction. 2. Sexual arousal dysfunctions, female sexual arousal dysfunction, male erectile dysfunction. 3. Orgasmic dysfunctions, anorgasmia. 4. Ejaculatory dysfunctions, male early ejaculation, male delayed ejaculation, retrograde ejaculation. 5. Sexual dysfunction associated with pelvic organ prolapse. 6. Other specified SD. 7. Unspecified SD. Each category of sexual dysfunction is further classified as lifelong, generalized. The person has always experienced sexual dysfunction from the time of initiation of relevant sexual activity, and the desired response is currently absent or diminished in all circumstances, including masturbation. Lifelong, situational. The person has always experienced sexual dysfunction from the time of initiation of relevant sexual activity, and the desired response is currently absent or diminished in some circumstances, with some partners, or in response to some stimuli, but not in other situations. Acquired, generalized. The onset of sexual dysfunction has followed a period of time during which the person did not experience it, and the desired response is currently absent or diminished in all circumstances, including masturbation. Acquired, situational. The onset of sexual dysfunction has followed a period of time during which the person did not experience it, and the desired response is currently absent or diminished in some circumstances, with some partners, or in response to some stimuli, but not in other situations. Additional coding for sexual dysfunction: post-coordination coding or sexual dysfunction associated with 1. HA40 etiological considerations in sexual dysfunctions and sexual pain disorders. HA40.0 etiological considerations associated with 1. Medical condition, injury, or the effects of surgery or radiation treatment. 2. Psychological or behavioral factors, including mental disorders. 3. Use of psychoactive substance or medication. 4. Lack of knowledge or experience. 5. Relationship factors. 6. Cultural factors. 7. Other specified etiological considerations. HAOO Hypoactive sexual desire dysfunction. Hypoactive sexual desire dysfunction is characterized by absence or marked reduction in desire or motivation to engage in sexual activity as manifested by any of the following. 1. Reduced or absent spontaneous desire, sexual thoughts or fantasies. 2. Reduced or absent responsive desire to erotic cues and stimulation. Or 3. Inability to sustain desire or interest in sexual activity once initiated. The pattern of diminished or absent spontaneous or responsive desire or inability to sustain desire or interest in sexual activity has occurred episodically or persistently over a period at least several months, and is associated with clinically significant distress. HA HA01.0 female sexual arousal dysfunction is characterized by absence or marked reduction in response to sexual stimulation in women, as manifested by any of the following: 1. Absence or marked reduction in genital response, including vulvovaginal lubrication, engorgement of the genitalia, and sensitivity of the genitalia. 2. Absence or marked reduction in non-genital responses such as hardening of the nipples, flushing of the skin, increased heart rate, increased blood pressure, and increased respiration rate. 3. Absence or marked reduction in feelings of sexual arousal, sexual excitement and sexual pleasure, from any type of sexual stimulation. The absence or marked reduction in response to sexual stimulation occurs despite the desire for sexual activity, and adequate sexual stimulation has occurred episodically or persistently over a period at least several months, and is associated with clinically significant distress. HA01.1 Male erectile dysfunction. Male erectile dysfunction is characterized by inability or marked reduction in the ability in men to attain or sustain a penile erection of sufficient duration or rigidity to allow for sexual activity. The pattern of erectile difficulty occurs despite the desire for sexual activity, and adequate sexual stimulation has occurred episodically or persistently over a period at least several months, and is associated with clinically significant distress. Post-coordination coding of causing conditions of male erectile dysfunction. Causing conditions: malignant neoplasms of male genital organs, diabetes mellitus, diseases of arteries or arterioles, diseases of veins, injury, poisoning or certain other consequences of external causes. HA02 orgasmic dysfunctions, HA02.0 anorgasmia. Orgasmic dysfunctions refer to difficulties related to the subjective experience of orgasm. This include anorgasmia. Anorgasmia, psychogenic anorgasmy, is characterized by the absence or marked infrequency of the orgasm experience or markedly diminished intensity of orgasmic sensations. In women, this includes a marked delay in orgasm, which in men would be diagnosed as male delayed ejaculation. The pattern of absence, delay, or diminished frequency or intensity of orgasm occurs despite adequate sexual stimulation, including the desire for sexual activity and orgasm, has occurred episodically or persistently over a period at least several months, and is associated with clinically significant distress. HA03 ejaculatory dysfunctions. Ejaculatory dysfunctions refer to difficulties with ejaculation in men, including ejaculatory latencies that are experienced as too short, male early ejaculation, or too long, male delayed ejaculation. HA03.1 Male delayed ejaculation. Male delayed ejaculation is characterized by an inability to achieve ejaculation or an excessive or increased latency of ejaculation, despite adequate sexual stimulation and the desire to ejaculate. The pattern of delayed ejaculation has occurred episodically or persistently over a period at least several months, and is associated with clinically significant distress. MF 40.3 Retrograde ejaculation. Retrograde ejaculation is a condition in which semen that is normally ejaculated via the urethra is redirected to the urinary bladder. Retrograde ejaculation is typically accompanied by subjective orgasm, though the man may notice that release of semen is limited or absent. Retrograde ejaculation most commonly occurs as a complication of transurethral prostatic resection, but may also be caused by other surgery of the pelvic area, nervous system dysfunction, or use of pharmacological agents. Confirmation is by identification of spermatozoa in a urine sample. Post-coordination coding associated with also applied to all ejaculatory dysfunctions: male early ejaculation, male delayed ejaculation, retrograde ejaculation. GC42 Sexual dysfunction associated with pelvic organ prolapse. A condition affecting women, characterized by difficulties experienced in the sensations or function of the genital system during normal sexual activity. Thanks for watching. Please like and subscribe.